We are MakilalaTV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
Welcome to MakilalaTV, the first and now longest-running Filipino-American TV talk show in the New York metro area, where we celebrate Filipino stories and representation. I am Rachelle Ocampo, lead co-host today, joined along with my co-host Cristina Pastor. Today's episode, Advancing Filipino Health Equity with the Care Registry, shines a light on the power of representation in healthcare and why our voices matter now more than ever. We are honored to be joined by Lily and Divino, a licensed clinical social worker and a master of public health and respected public health leader with over 25 years of experience advancing health equity across healthcare systems and within the Filipino-American community. Lily has led system-level health initiatives that have improved care for countless communities, and she continues this important work today by supporting community outreach for the Care Registry, which we'll dive into more later. She's also a co-founder of Filipino Community Health Efforts and a dedicated advocate for Filipino-American and Asian American, Native Hawaiian, and Pacific Islander health equity, ensuring that our communities are not only seen, but truly represented in research, care, and decision-making. Today, she joins us to talk about the Care Registry, what it is, why it matters, and how Filipino Americans can play a critical role in shaping the future of health in the Filipino community. Lily, maraming salamat for joining us here today at MakilalaTV. My first question for you is, what inspired your journey into public health and research and social work? Why not be a nurse?
Yeah. So, it's a professional and a personal reason. Actually, health was really important to me because at age 13, my dad had a heart attack and bypass surgery. So cardiovascular disease was something really prevalent in my family. And then my mom is a physician. She's an obstetrician gynecologist. And I got to work with her when I was a teenager and not only just see her as a great clinician, but how she interacted with the patients, how she listened to them. She would share stories with me about difficult situations between partners or a mother and daughter. So I saw the human side of making clinical diagnoses. To me, I learned that health and mental health is not just what you get as a what you get in medical care. It's really about people's shared experiences, how they live, and the communities and the environments they live in.
Yeah. Lily, can you tell us a little bit about Care Registry? What is it about and who benefits from it?
So the Care Registry, which is an acronym for Collaborative Approach for Asian Americans, Native Hawaiians, and Pacific Islanders, Research and Education. So it's a registry for research. So people who enroll into the registry will be eligible later on to be parts of different types of research. So it's not a research study itself. It's more I'm available for future research projects, and put me in the registry so I can be called upon.
So if I decide to join the registry,
yes,
what is expected of me?
So what first happens is you'll receive a survey, and it asks basic questions about you, your health, your demographics, your health conditions, if you have any.
Okay.
It does have questions about if you are a caregiver for others.
Which I am.
Yes, you are. And then there's also specific questions about different types of research, from less invasive to most invasive, and you can answer yes or no to each question.
Okay. And if there is a study that would be of interest to me or that is that concerns me, I will be called upon to answer.
If you fit the demographics of what they're looking in the research, and I think there may be an option where you can actually put your own interests. If you I know what you shared with me is if you actually are interested in the caregiving research.
Okay, got
So
it.
what are the types of research that Filipinos can be eligible for? What are you focusing on?
So care particularly focuses on aging. So that includes Alzheimer's and dementia. Caregiving. They definitely are looking at caregivers, not just people experiencing the health conditions, and healthcare across the lifespan.
What does that mean, that term,
So
care across the lifespan?
looking at different aspects of your health or people in our health is along a continuum. So how does it start like when you're young, when you're a child to a young adult? Your health changes too as you get older. When even a middle adult, it's going to be different when you're like an older adult.
Yeah. Who's supporting, funding your
Oh, thanks for asking that. So Care Registry is through the University of California in San Francisco.
How did you get involved? Because you're based in New York.
Yeah.
And this study is happening in the West Coast.
Yeah.
Why not have this study here in New York?
Right. So I was reached by Dr. Joyce Javier, who's very active on the West Coast in research. And she's also part of the Care Registry team. And she actually leads a Filipino outreach team. So she thought of me because the other thing is, like what you just said, it's heavy on the West Coast. So we need more representation in Philippines across the U.S. So here I'm on the East Coast, utilizing my networks, from working with Call Student Coalition, just also the communities here in New York and New Jersey. So we really want to make sure we're capturing all Filipinos in the US.
How do you reach out to Filipinos in New York? I mean, Filipinos are generally reticent about sharing information about their health, right? How do you make them understand that their information is important?
Well, first of all, I also make sure that, to be a trusted person, that we are not going to take their information and give it away.
Yeah.
It really just stays in the registry. And then, they can even withdraw if they want to. But everything's confidential. And also the research projects, we vet them as well to make sure that, they have the institution review board approval and have clear-cut methods for their research. And so, and you always have the option to, leave the registry, or you don't. And any research project that comes to you, you can say yes or no to.
Okay. And are you having a hard time recruiting people to the registry?
More so, I think what we've learned is, unfortunately, even with the Care Registry, and it reflects also our demographics in participating in health services, we are still kind of a smaller group within the Care Registry participants. But one thing to note is 80% of the Care Registry participants we have actually have never participated in research. So we're actually tapping into people who maybe wouldn't have thought of it before. But yeah, I think we're really trying to catch up from the Filipino American representation.
So for me, I'm also in public health, and it's just, I'm so happy that there's this types of initiative, because we're so underrepresented.
Correct.
In not just data, but in overall, but in the AAPI data, we're just so underrepresented. I feel like that if we are not part of these types of studies, we won't be part of the conversation of these very important decisions of policy, of funding. If they don't know how many Filipinos have dementia, how are we going to be able to advocate for support and resources?
And also to develop culturally responsive initiatives for our community. It's not going to be the same if if you're going to do an intervention with the Chinese population or Korean. We have our own things that we have to influence our health and our behaviors.
So what happens with the information that you collect? Who has access to this information, and how can they use it?
So first, it's monitored by the UC San Francisco, and any researcher has to request to access the registry, and they show what the research about, getting, as I mentioned, the IRB approval. So they're vetted first to make sure that any research that's shared with the registry is legitimate and trusted.
Are you part of that portion?
I am not. I'm an outreach person.
Oh, okay. All right.
So the data that's collected, is it like de-identified that they won't ever be able to follow up with you? Or how does it, what does that follow-up look like?
So they do provide you, you provide your information so they can contact you. We also get permission to be contacted in one method.
Really?
But again, the information should not be shared outside of that realm.
Okay. Yeah, I know it's something what Cristina mentioned before, that we're kind of hesitant to share our data
Yes.
in general, let alone our personal health information.
Yeah.
But what is that? What are the types of health disparities or health issues that are specific to Filipinos that we need more data on?
Yeah. So one of the things I've seen in research, actually, with mental health, we have higher risk, but we're the least of all Asian American groups to seek help. And then,
For mental health.
yes, and then with dementia, we actually have the higher rates of dementia among all Asian American groups
Really?
too.
How do you explain that?
I don't know. That's what the research is needed for. And so it's limited research, but that's actually why we need more representation to find out more. There is, I do think there's one research project where they are looking at dementia diagnosis, treatment, and, follow-up care.
I'm curious about the mental health
Yes.
condition. Why we are the least open about it.
Yeah. I do think that's tied to our cultural, perspectives around like Hiya and Bahala.
Yeah.
And we kind of keep it within the family.
Yeah. That's right.
So unfortunately, that's kind of the barrier for us. But then I think if we reframe it and, we want to help the rest of our community, then we want to tap into, the bayanihan concept of like, let's support each other, but let's support each other by making sure we have enough information to make sure we're getting the services and, the care that we need.
Yeah.
Because I feel like that along with the hesitancy is just not knowing enough about research.
Yes.
So what are the misconceptions of joining a research project?
I do think you've mentioned some of them already, like the trust, what's going to happen with my information. I think when anyone approaches a participant for research, they should be really clear of how information is collected, from like how they actually store the information. Those as potential enrollees should be asking those, participants should be asking those questions, right? And so I think informing people too that any information is also kept private. Like nobody else is going to hear. And like you mentioned earlier, once you are in research, it's de-identified. So they may just kind of say we had X amount of people who were female, ages XYZ. So, but no research is going to disclose exact people like who participated.
Are younger Filipinos more open to sharing information about their conditions compared to their elders, for example?
I'm not going to generalize, but having a nephew, so much more aware and, I told him about care and he wants to share it with his colleagues and friends. I share it with his mother, so I do think there's an opportunity for the younger generation, but, we still need to care for like our fruits.
Yeah. That's
so we're trying to really get the elder population to participate.
So who is eligible for the care registry? Because I know that you have a background in adolescent health, but who can actually join?
Anybody 18 and above, anybody who self-identifies as Asian American, Native Hawaiian, Pacific Islanders, that includes Filipinos. Surveys are actually available in different languages, so Tagalog, Vietnamese, Korean, Chinese, and Hindi. And also it only takes about 10-15 minutes.
Oh, okay.
It's really quick. And then you have the option to get the $10 gift card. And then you decide whether you want to be contacted, how you want to be contacted.
You mentioned that the registry needs something like 20,000 people to be part of it.
Yeah.
How far along are you?
We're halfway there. So about 10,000, still growing. And so, that's actually a positive. But we definitely still need to see more Filipino Americans participating.
How long did it take?
We are the least represented.
How long did it take you to reach 10,000?
So for my
when did you start?
I think the project, it's called Care 2.0 because it's the second year and we're getting ready for the third year.
Oh, wow. Yeah. Okay.
That's not too, it's a little young, right?
Yeah.
Well,
2
years. I don't know. Is it like how long how much funding do you have left to collect all these? What's the timeline?
So I do think there's another 2 years left.
Okay.
Oh.
Yeah. And the first 2 years definitely was heavily focusing on the recruitment for enrolling people into the care registry, as well as, reaching out to researchers. I think the other work that's happening now is actually reaching out to community members to learn more about different, about health issues in the different communities.
Do you see the registry branching out into the different health conditions like maybe autism, LGBT health, other areas? Or are you just focused on dementia, caregiving?
I think that's a
Any other
focus
one?
right now, and I'm assuming because it's grant funded that it's
I see.
under our umbrella right now. But I know some of the questions actually ask about, demographics like, sexual orientation.
Yeah.
So there may be though, what's the difference for dementia where you have a same sex partner, So
Oh, interesting.
yeah, so I do think by sharing your identity, you may be eligible to also actually represent the diversity within the Filipino community. Like how does it affect one person versus another person in the Filipino community?
Yeah, I feel like when I had a little taste of research when I was working at NYU, and I just felt like that there was just not enough representation of Filipinos in the Filipino community. I want to know, what ways have you been able to or plan to outreach the community to really make sure that we're there?
Well, first, thank you for this opportunity to get out there. I think we were talking about this earlier. We're like, going where the community members are. I was actually talking to my mother to go into Filipino church groups. The PNA is pretty big, the Filipino Nurse Association. So I'm trying to network with them to, have them enroll, but also share it with their communities, with their members. And I'm looking for opportunities. If anyone knows, I'm looking for opportunities where I can, table and give presentations.
FEEDC would be a good occasion, right?
Yeah.
The
Oh my God.
parade on Madison Avenue?
Yeah.
That's a big one.
Yeah. It's coming up.
It's coming up in June 12th.
Okay. I'll look around. Make sure I didn't miss the deadline.
Yeah. Yeah. Keep an eye on them.
Yeah, I feel like that when I look at data, I always go look at, what does this compare with the Filipino community?
Yeah.
What are some other topics? I know you mentioned cardiovascular, dementia, mental health. What are the other topics that we should be getting more research on? Because the care is really for a specific group, but what are the other ones that are underfunded?
Well, I'm not sure what are underfunded, but when I saw the list of different types of research right now with care, they were also looking at parenting and family wellness. They were also looking at menopause in Filipino American. Yes.
Yeah.
And another one was the sleep health of migrant Filipinos. So I do think there's diversity in some of the research, because think about the researchers who are coming in are also coming from different, they're coming with different projects. So I think I do think there's an opportunity for research who want to study AH, AA, and HPI communities. Now they have people that they can actually, recruit.
So what happens to your research, to your findings? Will it be presented to Congress, or
It depends.
who will have access to it?
So the information is shared with people who do register. Like they actually get updates through newsletters. So they'll actually, I think that's really important to show what happens if I register or if I participate. So I think that's actually really important, is to okay, what happened to my information now that the study is over, right?
Yeah.
So I think there's a conscious, a thoughtful method to make sure we're also keeping people in the loop of what's happening.
Yeah,
Which I think that's actually building trust too, and we're not just disappearing.
So, you mentioned this is really based in the West Coast. So, what have you seen is the difference between the West Coast and the East Coast in terms of outreach, and why does this feels like there's more Filipinos supported
In the West Coast?
initiatives?
Also the history. I think there's longer, older generations on the West Coast. I mean, it's changing now, but when I grew up in New Jersey, there weren't many of us, and I do think, it's just the different dynamics too, where I think it's getting better where you see more Filipino, businesses. So that's the positive thing. And I think, I think the West Coast I think there's a little bit more cohesiveness over there. I know here on the East Coast, from my own experience, I think, Jersey Filipinos from a New York Filipino. And, we're in pockets as opposed to like having big enclaves, like on the West Coast. So it's just a
Like in
different
California.
yeah.
Oh, really? Okay.
So it's a different strategy, but, I don't think
Are
the
they
same.
more cohesive there?
I just think there's bigger communities too,
okay,
like,
right.
historical towns and, Daly City.
Because here we're like different pockets of
Yeah.
people,
Yeah,
groups of
smaller
organizations.
smaller
Yeah.
pockets.
Yeah.
Yes.
We're like mingled with also the other
Yeah.
Asians too.
And then we come together and there's a big party.
Yeah.
That's true. That's true. Yeah.
So whoever is interested in joining the registry, they answer questions, right?
Yes.
The questions will be mailed to them.
I'm not sure if you're going to be able to share. There's a QR code to the survey.
Yeah. And they answer. Oh my God, a lot of people don't respond that way, right?
They could.
I've seen some people, give out survey questions, and there's not a lot of reception. There's not a lot of positive reception.
They can also go to the website, care.registry.edu, to enroll into the registry.
Okay.
So that's the other way of doing it.
Will there be an opportunity for an extended, I don't know, maybe interview with the people who join, or not? They will be limited to the questions that are presented on the website.
Yeah, it's really a tool to see what areas the enrollee could fit into.
Okay.
And again, it's matching them with what research is actually existing now.
Okay.
And so if there are researchers out there that are trying to tap into the Filipino community, they would reach out to the CARE registry.
Correct.
And ask if they could tap into that data.
Yes. So if you look at the CARE website, they actually have for, community members, for researchers, and it goes through the process. They actually have updates on, different research that's happening. So it's a comprehensive website. But it's a good, for researchers, it's a good resource.
Is your website now up and running?
Yes, it's been up and running.
There,
yes.
Oh, so we can go there, and if we have questions,
yes,
it will be answered.
There's questions there, and you can actually get a lot of the promotional materials in the different languages as well.
All right. So there's materials there in English and in Tagalog.
Yep.
As part of the CARE registry, what else should we expect when you are involved in the CARE registry? So there's just the demographic survey.
Yes.
You get a confirmation that you're part of the registry.
Yeah.
And then you get a follow-up email saying these are the studies that you're eligible for, or is it just ongoing?
It's
like rolling?
ongoing. I'll give you an example. I actually got a letter in the mail recently because I enrolled myself.
Like in like snail mail, like physical mail got.
Like
okay.
I don't know if that's what I opted. Maybe what I opted for, but I was actually surprised because I enrolled maybe in January.
Okay.
And already, I just this past week, I got a letter about a study that I may be eligible for. I haven't contacted them, so I'll ask more questions. But I thought that was pretty quick that I was already eligible for something.
Yeah. Okay. I feel like that there's still some, not challenges, but just some misconceptions of why Filipinos should be joining a registry like this, especially in this environment where funding has been significantly cut.
Yes.
Have you seen or feel like that might be a challenge for the CARE registry?
The funding?
Yes. Yeah. Like, will it is there a possibility that it might be cut and other future research?
That's a good question. I mean, I can't predict the future, unfortunately, but I do think the fact that the CARE registry does exist, and you even mentioned some other ones, there's something happening where people still want to do the work to make sure we're encouraging all different communities.
Yeah.
So I do feel, I don't think that's, and from the meetings I've been with CARE, everyone's been really energetic and whichever community they're working with, and it's been inspirational. So I feel there is good energy to do this work right now. And I think it's much needed. It may not be now, and if this research project wasn't funded, then they're not going to reach out to you, right? But the fact that there's researchers, like I said, I was surprised. Actually, I qualified for a research project, so someone's getting funded.
Yes,
right?
yes.
So I think what we have is great, and I think we should, if we can promote that more, and then maybe that's the advocacy we can do by participating in research, so that we're represented the research person look like us.
Yeah.
You know, like, oh, wow, I can relate to that. I think that's really important. And like, you know, if there's any hesitancy, you know, I can get my information out. People can reach out to me to ask. I enrolled my mother, try and enroll everyone in my family because we want different representation. And, you know, I had that conversation with my mother. She's like, you know, a lot of people are going to be hesitant. So, but to her, it was important. You know, she wants to be included in the research because, you know, as she says, she has a lot to say.
No, I feel like that some people want to share it. It's just that
some,
yes. One of the last questions, other than my final question, is actually not really a question. It's a comment because from my experience with research and data, there was, you know, public health findings from New York City, a report for Asian Americans. And of course, I looked at Filipinos and it showed that we were one of the lowest of applying for health insurance.
Yes.
So I used that data to go to these health insurance companies and be like, hey, you need to reach out to the Filipino community and get us access and insured. So that was able to get me some resources to make sure that they cover. So it's really important that this information makes a bigger difference outside of just you sharing your story. So thank you so much again for sharing the care registry. We do have to close.
Okay.
And I do want to ask the last question, which is for someone who's watching, who feels hesitant or unsure to join the care registry, what's your message to them?
Representation is so important. Like, if we want our communities to be healthier, we need to be part of the solution and participate. If we can't create things for us if we're not part of it. You know, nothing without us, by us, for us, you know?
Exactly.
So I encourage people to, if they have questions, and rightfully so, I understand the hesitation, then reach out, ask questions, contact care, contact me. You know, I think by participating, you're also not helping our current generation, but it has the potential to really impact our future generation too.
Yes. Thank you so much, Lily. And again, what was the website for care?
care.registry.edu.
Great. And thank you again for joining us, Lily.
It's been a pleasure.
For joining us at MakilalaTV.
Thanks so much.
And we'd also like to thank our host, Manhattan Neighborhood Network, and all of our viewers and supporters. Sa ulitin.